Hello and welcome to Age-Friendly Maple Grove's Zoom interview series. I'm Chuck Schwalbe, your host. Age-Friendly Maple Grove is a community-driven initiative to make Maple Grove a better place to grow older. Good day, this is Chuck Schwalbe talking to you on our live interview, our Zoom series. And I want to just thank you all for tuning in today. With Age-Friendly Maple Grove, we're going to spend some time talking with Jetta Wiedemeyer-Bauer. And I'm going to let her introduce herself as well as what she does.
Great. Well, thanks, Chuck. My name is Jetta, and I direct the activities of our volunteer and outreach department at the Metropolitan Area Agency on Aging. We serve the Twin Cities metro area and are one of 6 of the area agencies on aging contracted by the Minnesota Board on Aging to operate the senior linkage line in our state. And MAAA is an organization of about 100 people alongside 80 incredible volunteers.
Wow, it's a great group. So what's your role in the senior linkage line?
We work with volunteers. So half of my team works in presentations and outreach, trying to educate our public in the metro area about all things related to the senior linkage line. Right now in the pandemic, it's about Medicare because we're right in the middle of Medicare open enrollment. The other half of my team works with volunteers, coordinating the activities, keeping them organized, getting them educated and trained so our volunteers can do a wide variety of work for MAAA.
Wow. So can you give me an overview of, what kind of services do you offer with the senior linkage line?
Sure, absolutely. The Minnesota Board on Aging developed the senior linkage line more than 25 years ago to provide older adults and caregivers better access to resources and services. So the senior linkage line mainly serves a few areas. So first, the senior linkage line has a call center. So our staff handle calls that come into a toll-free helpline. We handle them Monday through Friday, 8 to 4:30. Last year, over 110,000 points of contact were made with older adults and caregivers, providing information and resources on Medicare, housing, transportation, financial services, and a variety other of community supports. So if someone wanted to call, our specialists can assist callers by explaining Medicare in easy to understand terms, or presenting unbiased information about Medicare plans, because we're not insurance brokers and we're not insurance agents. We just have unbiased information and we provide options, and then the consumer gets to choose what's the best plan for them. Our specialists might also assist in finding resources to help in a wide variety of issues, from nutrition to transportation. They might provide resources to caregivers, housing options, or even financial or legal assistance to callers. So that's kind of one area of the senior linkage line. The second is called Return to Community, and it helps people who are dealing with really complex health situations, and we're helping them go home after a stay in a nursing facility or a stay in the hospital, or to remain in their home when they're facing difficulties. So community living specialists normally meet in person, but now during the pandemic, we're meeting on the phone with older adults and caregivers. And for those who qualify, our specialists help find services and resources to support living at home. We might develop an individualized plan for the family, and we're able to follow up with phone calls up to 5 years after the first point of contact. And
Wow.
For this team, yeah, it's amazing. 5 years.
That is amazing. 5 years is a long time.
It helps people kind of stay where they want and feel really comfortable, like they've got someone to connect with, and they've got an ally. And our whole hope is to help folks age with grace and dignity and grace, age well.
Absolutely. And that's an important piece of the puzzle. And especially now, I mean, it's always been important for older people to, live their life as they would like to live it.
Yeah.
And now we're dealing with that. Now that we're dealing with other reasons that we are having more difficulty, it's nice to have someone to talk to, someone to give guidance to. So that's a really important piece of the puzzle.
And the neat thing, I think, of all of our services, it's completely free for folks. So it doesn't matter income. It makes no decision in the rule. People can call for free.
So the program is supported by the state. Is that?
Yeah.
That's what I'm assuming. That's good.
Yeah.
So
we have the phone line, and we've got down the middle kind of return to community. And the third area under the senior linkage line is pre-admission screening. So anyone who enters a Medicaid certified nursing facility in our state has to receive a pre-admission screening according to state and federal laws. So our staff review those screenings to ensure that a nursing facility placement is appropriate. And our staff will refer individuals who may benefit from additional supports to the county office.
Okay.
The pre-admission folks, they also provide phone support, similar to Return to Community. But our hope is to support independence in a community setting. And this group actually, the PATH team made over 36,000 screenings in the metro area last year. So a lot of work is happening on the senior linkage line, Chuck.
That's fantastic.
Mm-hmm.
So the Metropolitan Area Agency of Aging is doing.
It's a mouthful.
Yeah, I was going to say the triple A, but that's probably just as MAAA is probably just as hard for me. Serving older adults during the pandemic have you found, obviously not meeting in person is number one on that list, I'm sure.
Right.
Have you found that it's even more difficult because of what we're facing as a pandemic, and also this time of year, because we are talking right now in the fall of the year, and we know that the numbers are on the rise. There's more people in the hospital than we've had in a while.
Mm-hmm.
How do you process with the older community, knowing that they're also the most vulnerable in this process, and what changes have you had to make?
Yeah, well, the pandemic certainly has thrown us some curveballs, but when you have challenges and your back is up against the wall, you have opportunities, and I call them silver linings. We are seeing silver linings all the time. And I think the fun fact, for the United States is we're on track for 20% of our population to be over age 65 by 2030, which is 10 years from now.
Right.
And so at MAAA, our work is to celebrate older Minnesotans. We want to work every day to help them be in the community and age well. So we can't be stopped by a pandemic. The work is just too important. And so what we found is that, connecting with people, making in person, which is by the phone, connections and sending things through the mail really has helped folks feel a little more connected. But we certainly are struggling. I mean, our entire society is struggling. But we've done a couple of things I think that have been really amazing and then kind of fall under the senior linkage line. The first is offering virtual presentations. If you can't have them in public, we're going to have them by Zoom. So this is the team that I actually manage, the volunteered outreach. So because we used to do this in public, we had to pivot, and now our outreach specialists and our volunteers offer educational presentations virtually to community members. And we partner with community organizations, employers, libraries, and others throughout the 7-county metro. We often partner with Maple Grove in this work. If folks wanted to learn more, I'll have our website up, but it's metroaging.org presentations. People can learn a little bit more to help them in their daily life through a couple presentations. We do one on Medicare 101. So someone who's 63 or 64, kind of aging, almost 65, that magic number. We'll do a presentation on Medicare because, quite frankly, it's a mystery, right? And we're going to go through the A, B's, and C's, and D's of Medicare so that folks can feel a little bit more comfortable on when to apply, eligibility, and the different plans that they might be able to choose. And again, we're not insurance brokers. We don't have any stake in the game. We just want folks to have good information.
Yeah. Well, quality information makes quality decisions.
Oh yeah, and it's you see all the advertisements on TV all the time. I'm just mystified at it. But we just we're funded by the state. We have no stake, so it's we just kind of prevent it as kind of a buffet and saying these are your options. So they can learn about Medicare 101, and then we have a presentation for people who already are on Medicare, so they're older than the 65, and it's a comparison. It's an annual update. So we look at what the plan says in 2020, and then we're looking at 2021. What's changing? They added some insulin things this year. They added a couple tweaks. The plan costs are changing. So that's a great time just to kind of get educated and kind of get the wheels turning, because open enrollment goes to December 7th. Mm-hmm. We have a presentation on healthcare scams and fraud, it's incredible. The insidious plans that people particularly during COVID right now, to kind of steal folks' money. And as we get older, we get more vulnerable. So that's just a brilliant presentation. I just love to listen to that one. We do one on healthcare directives, so end of life discussions, which is great for both people who are getting older, but also for family members to kind of think about things before we actually get into the mix of it. And you don't have to be in your 60s, 70s, 80s. I mean, an 18-year-old needs a healthcare directive because you just never know what's going to happen. But it's particularly helpful for the older population. And then we do a presentation on the senior linkage line, because there are tons of different options that folks can be part of. And, it's great because you can dial in, and there are different times during the day, different days of the week to kind of learn a little bit more. And we have at least one of them on the website so that folks can dial in at any time and learn a little bit more about it. So
Yeah.
that's kind of the second thing we do, the presentation piece. The interesting thing is that we used to do phone-based appointments for personalized one-on-one health insurance counseling. And as you know, Maple Grove was one of our sites where
Yep.
our volunteers met in person with the community. We met in a private setting to discuss Medicare, and we would compare plans and help them look at their prescription drugs and figure out, will this plan be better for them or this plan? And we just do cost comparisons. Well, of course, this was put on hold during the pandemic, but we just
Exactly.
started and launched the pilot project 2 weeks ago for residents to schedule their appointments. And they can go to our website to, schedule a time that fits in their calendar. They don't actually have to call the 1-800 number and wait on the line. So that's
Okay.
kind of the next part. And then the neat part, it's sad that we need it, but the governor's office designated MAAA as a distribution point for free masks during the pandemic. And we just learned, Chuck, that Hennepin County has 45,000 free masks to distribute for folks who live in our county. So if you or someone else needs a mask, you can give us a call on the toll-free helpline, which is really exciting. And I'm going to share my screen just a minute to kind of give information on the options. And so folks wanted to just register for a presentation. It's just metroaging.org/presentations. If they wanted to have personalized one-on-one, because in a presentation we're broad, we talk to folks about general things around Medicare, but we don't want to get into privacy issues. So if folks wanted to talk one-on-one about their plan, then they could do metroaging.org/HIC, which is Health Insurance Counseling.
Gotcha.
But if there's, if they want to talk about transportation, or they want to talk about masks, or they want to talk about anything else related to the senior linkage line, you can absolutely just call that 1-800 number, 800-333-2433.
Fantastic. Well, that was a lot of information. Hopefully people had a chance to take a look at it, and we will put that on the end of this interview so that people hopefully can catch it a second time. That's really important.
Yeah.
Now you've mentioned throughout this that funded by the state. You mentioned the process by which people can get information, which is so important to their aging and the issues that we're having every day. What about volunteers? Now, you've mentioned volunteers a few times.
Right.
Can you tell me what volunteer options are available at MAAA?
Yeah,
And,
good job.
and
You got
thank
it.
you. and how that works, and is it open to everybody? Is it, are there specific qualifications that you need, or just give me a little background on the volunteer process?
Okay, I appreciate the question. Talking about volunteers is by far one of my favorite topics. We partner with upwards of, like I said, 80 volunteers. These are amazing individuals. And last year, I think they donated over 5,500 hours to the organization and serving their neighbors across the metro. And our volunteers do a variety of work. So I talked about the senior linkage line, the phone bank. They're volunteering on the phone bank. They're doing it now virtually. The health insurance counseling, that isn't done by staff. All of that counseling by the appointments is done by volunteers to compare cost and help folks make better decisions. So that's all volunteer based. All of the presentations, we have 2 staff and then about 15 volunteers that are doing Medicare, open enrollment, healthcare scams and things. And so that's really important. And these are just normal folks, right? They're just interested in the topic, and they want to do public speaking. So, and it was hard shifting them to Zoom. This is trying something new.
Yeah.
And these folks are really good at it.
Well,
In
that's good.
our office, even during the pandemic, we've had folks doing administrative tasks. So we have folks doing data analysis. We're emailing things back and forth. They're cleaning up Excel spreadsheets. They're making telephone calls to senior community centers for us across the metro. We have a couple volunteers that are in communication. So they're editing social media posts. They're writing new content for newsletters. We have one volunteer in a department called Pension Rights. It's not funded by Senior Linkage Line, but let's say 20 years ago you retired and you wanted to start pulling that pension, but your business went out of operation. We have a volunteer that is doing internet searches and working with our attorneys to secure lost benefits that folks thought, well, I'm never going to get this back. And then they go in and by law, you can't just stop a pension. You have to donate it to somewhere else. Another organization has to take it on for you. So
Right.
we have a volunteer helping in that department. And we also have a volunteer working with Dementia Friends. So it's a program to educate folks on dementia. And this
Cool.
individual is helping us update a very, very outdated list of volunteer trainers. So in terms of, getting involved, people are speaking, they've got education about Medicare, they're doing administrative, they're doing data analysis, they're doing things that they were just good at, in their normal life, and
Yeah.
they're doing it now. So folks, we're going to bring a new crop of volunteers on at the top of the year. We're in open enrollment right now. So sometimes you're up to your gills in work. So we don't want to bring
Right.
on anyone right now.
At least through December 7th.
Yeah, exactly. And then we'll take a couple weeks just to take a breather, right?
Yeah.
So we'll bring folks on in January, and you can find us at our website at metroaging.org. There's a tab for volunteers. For the most part, it's just average folks. I would say 80% of our folks are 65 or older. We have folks who are younger. We have some interns that come in, and they're all different, right? They're all from different
Right.
walks of life and doing different things. And we try to find skill-based things that either folks want to be trained on or work that they have a passion for, and we try to make it useful to them. It's been hard during the pandemic. For the first 3 or 4 months, everyone was sitting idle, and then
Right.
we slowly started outthinking. I call it outthinking the pandemic. Of you're back against the wall, and you have to be creative. So now we've got a majority of our volunteers doing work that they love and they find meaning for. And that's why I do what I do in terms of volunteers, is because volunteers are giving their heart, they find purpose, they find value. And it's just really exciting when you can get someone, and they can come in virtually, right? They can come
Right.
in once a week, they can come in twice a week. Everything is electronic for them, and we just kind of teach them the tools to get comfortable. And again, some of the folks don't want technology at all, and so they're doing phone calls for us, you know.
Right.
And so everyone has a role to play, and we would love to welcome folks.
Yeah. Everybody has a skill level that can be used. It's just making the effort to go and volunteer, whatever that
Yeah,
might be. So,
yeah,
I mean, I'm hoping that people are hearing what you're saying, that we're going to need new volunteers at the beginning of the year. So maybe they can prep themselves for that opportunity. And
right.
this is great information. And I believe that this is something that people need to at least touch base with, especially the people in Maple Grove and the
Yeah,
people that are, living in their homes at a older age and more mature. And these are opportunities that maybe they haven't taken the time, or they don't want to call 1-800, find out about, insurance. This is more right here in our own community and right here in Minnesota. And it's something we should really be taking advantage of. So my pitch for the MAAA, we need to have people getting a hold of you and trying to help get people, but also get that information out as much as possible. So
yeah. I think there's tons of dollars that go unspent because there's lots of programs. Just for one example, there's a lot of programs for low-income folks, and tons of money goes unspent every year because people just don't know to apply for the low-income subsidies or Medicare savings programs. And our volunteers are just so well, and staff are so well educated on that. Just a couple questions could raise up that flag of, oh, I can cut down my prescription costs by this. I can reduce my premiums, my copays, simply by asking the question. And no one knows. It's completely confidential, so no neighbor knows. It's just, if you're eligible for it, we want to save you the money so that you have a great plan. I mean, some of the best calls with my volunteers is they get off the phone bank with someone like, oh, I just saved someone $1,000 this year, and they're giddy. You know what I mean? It's not
Yeah,
their money, right? They're
no,
giddy with excitement, and that's why they do what they do. It's because they want to help their fellow neighbors.
that's a fantastic feeling when you know you're doing something to help someone else. It's bigger
Right?
than yourself and all the other things that go with it. So really,
Indeed.
so Jetta, I appreciate so much your time tonight, and or I said today or tonight, whenever you're watching this. I appreciate your time, and it's really been interesting and also very informational, and just look forward to getting this out to the rest of our people out there, and hopefully people will take advantage of it, which I think is what they need to do. So,
We hope so too. Thanks for your time. We really appreciate it.
and thank you. And for everybody out there watching, it's this is brought to you by age-friendly Maple Grove. And we are really happy that you're watching this, and we look forward to seeing you again in the next one. So be safe out there, and we'll talk to you soon. The City of Maple Grove is a member of the World Health Organization and AARP, Network of Age-Friendly States and Communities. Since 2016, we have been working on a variety of issues to make sure that older residents can live active, purposeful lives in our city.